Hello, I'm Dr. Jenny Andrus, and welcome to Joint Ventures. In this OSC original podcast, we take a look at recent medical news and headlines. Medical news is constantly being thrown at you. Often the headlines are misleading or they lack context. That's why we're here. We're going to flesh it all out for you to provide you the information you need to make decisions about your healthcare. Now, I'm an interventional pain management physician at Orthopedic and Spine Center in Newport News, Virginia. So the title today says you can't always trust the experts. And here I am telling you that I am indeed an expert and you can trust me. I know that irony is not lost on me, but I'll tell you today, it's not just me who thinks the British Medical Journal just made a fool of themselves. As of last count, 34 medical societies have called for retraction of this BMJ article and the guidelines, calling them, quote, misleading and irresponsible, end quote. So you don't have to take my word for it. This article is junk. Recently, the BMJ published a review article on commonly performed procedures for chronic non-cancer spine pain. This was a systematic review and a meta-analysis of randomized trials. Sounds good to start. Okay, so then why am I so worked up about this? Well, this BMJ article supposedly was a review of commonly performed spine procedures. So a lot of procedures that I do every day to help my patients and improve function in my patients. And they said none of them worked and none of them should be performed. Say what? This isn't someone saying, hey, this joint injection or this specific procedure isn't as effective as we had hoped. Heck, that happens all the time in medicine. And if something isn't working, we want to know. That way we can either modify what we're doing or scrap it completely and try something else. I am happy to consider that. But seriously, they were telling people that spine interventions in general don't work and should be avoided. Like every colleague I talked to, I was honestly flabbergasted. And I assumed this had something to do with payers wanting to avoid having patients seek treatment. What are we going to But we're going to go through this, okay? And we're just going to, let's just say that I think some of the motivations here just don't seem so purely academic. But first, let's consider how they looked at the procedures. So the authors put together studies using different techniques in different parts of the body and said they don't work. So for instance, they looked at radiofrequency ablation. This technique is frequently used to treat spine pain emanating from joints called facet joints. The nerve supply and the sensation to these joints is damaged, which reduces the ability of the nerve to then send a pain signal. This is probably one of the best studied spine interventions with robust data supporting it. Well, the BMJ review lumped this in with non-ablative or non-destructive procedures called pulsed RFA, which are not even routinely done in the U.S. because insurance doesn't usually cover it. They lumped the sacroiliac joint, pulsed RFA, which is joint connecting the spine and the pelvis, with a different type of ablation being done in the cervical spine or the neck. Say what? No serious investigator would compare apples and oranges and tell you it was the same. I would have been raked over the coals in residency if I had come up with this idea for research. A serious clinician or serious investigator would not aggregate data from very different patient populations with different diagnoses and different procedures in different regions of the spine and compare them all together. And if they had to do that for some reason, they would detail how that limits the interpretation of that data. I mean, this is real amateur hour stuff. Another fatal flaw of the proposed guidelines is that they used studies of abandoned procedures and non-standard and non-covered techniques to draw conclusions about the use of and coverage of commonly used and well-accepted techniques. It's almost like they included the things we know don't work to bring the whole group down. So what I mean by this is if you have 10 studies on a treatment and 4 are performed one way and show benefit, and 6 are performed another way and don't show benefit, and you lump them together, guess what you get? No benefit. But you aren't even comparing the same things. It's very misleading. Now, the truth is, interventional spine data isn't as robust as we would all like it to be, for sure. And unfortunately, that's the reality of a lot of things in medicine. We would all like to see more research. But the BMJ article authors literally left out studies that were randomized controlled trials. So we're talking the gold standard, okay? They left these high-quality studies regarding radiofrequency ablation and epidural steroid injections out of their analysis. Bizarre. Why in the world would they leave out high-quality data showing benefit unless they wanted to skew the data? They also didn't even look at the technical factors related to procedures. So in a call for retraction letter signed by many societies, including International Pain and Spine Intervention Society, American Academy of Pain Medicine, American College of Radiology, American Society of Neuroradiology, American Society of Regional Anesthesia and Pain Medicine, North American Spine Society, and the North American Neuromodulation Society, they stated, and I'm quoting them now, "We acknowledge that interventional spine procedures are not universally effective and that careful patient selection is essential. We agree with authors that patients suffering from chronic spine pain deserve to be properly informed and receive personalized care where they choose their path to safe and effective pain relief. When provided with treatment options and informed consent, we remain confident that many patients will continue to choose interventional spine procedures performed by highly skilled and caring physicians. When performed with technical precision and integrated into a broader, individualized treatment plan, these procedures have been shown to provide significant benefits. We also stress the importance of selecting, analyzing, and aggregating appropriate studies when developing clinical guidelines. We call upon researchers and clinicians and policymakers to recognize the complexity of chronic spine pain and to support expanded research and ongoing access to interventional procedures underpinned by rigorous clinical standards." End quote. Okay, guys, so this irresponsible and poorly done analysis will unfortunately be used to deny access to care and craft policies that will harm patients. To conclude, like the authors did, that procedures don't work because they aren't permanent fixes would mean that essentially no treatment for any chronic condition is beneficial. Most things in medicine aren't cures, unfortunately. They are management. The idea that if spinal pain isn't resolved forever from a treatment, that the treatment then isn't beneficial seems cruel to all of the patients who get relief from intermittent procedures. For most patients, these treatments are not done in isolation, but with therapy and medicines and other modalities. And for many, there aren't a one-and-done proposition. So does that mean we should just let these people suffer? Okay, so how did the BMJ respond? Sort of like my middle son, who when I have caught him saying something silly or doing something wrong, he digs right in, and tries to convince me otherwise. In my house, we say, "Hey, are you going to double down on stupid?" Well, they did just that. They said they have no plans for further action or retraction, but they will publish critiques. How magnanimous of them, huh? And then I look at the list of the authors, and I don't see doctors with experience in procedures to help them interpret the clinical utility of the studies included or evaluate the procedural techniques used. They aren't even using experts in spine care to help interpret the data. So basically, just like everything in medicine, a one-size-fits-all approach doesn't work. Chronic pain, and especially spinal pain, is complex and it's usually not solved with one specific modality. All of us who manage patients know that. And using a poor methodology review study to deny patients care is gross. Okay, I had to get a little fired up. I'm sorry about that. But I really thank you guys for hanging in there with me. This article is just, it's going to be used to harm patients. And I wanted to make sure that you guys understand where I'm coming from. Thank you again. Subscribe, share with a friend. We don't want you to miss out on any future content. Thank you again. Wishing you good health. See you soon. Bye-bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.